Well, we've been talking kind of all week about school is back in. For most people, high school, for my kids at least, starts on Monday. And you know what that means, fall sports. Fall sports of all kinds are happening right now. This is Dr. Kevin Stucki. He is an orthopedic surgeon up in Ogden. And we're talking about kids playing fall sports. Doesn't have to just be football.
Right.
Can be a number of things, including cheer and dance, where injuries happen.
Well, and most of these sports are going year-round now, so we do see a lot of fall sports start, but some of these kids have been playing sports all year.
Let's talk about that, because I'm one of those guilty parents. I have 3 boys that, well, I have a daughter that plays year-round soccer, my other daughter year-round dance, and then I had 3 sports and my other kids, baseball, basketball, football. They really didn't have a chance to take a break. How hard is it on their little bodies?
Well, it can be very difficult. As you know, these athletes are still growing. And one study from the American Academy of Orthopedics showed that most high school athletes are having the same number of injuries as some of our NFL type athletes.
Wow.
So they're having the same number of injuries, but the problem is that their little bodies are still growing, and that puts them at an increased risk for injuries that can cause detriment to the future.
Okay, so let's talk about some of the injuries that you're seeing.
Sure.
For fall.
It really is sport specific. So if you're a swimmer, it's going to be most of the time the shoulder and the lower back. If you're a baseball thrower, it's typically the elbow. If you're a football player, it really can be anything depending on
Yeah.
the position you play. It really is sport specific, but a lot of sprains, a lot of strains. Injuries fall into really 2 classifications, and that can be your acute injuries or traumatic injuries where they actually strike a ball or another opponent or the floor or the ground or whatever it is, or the more overuse injuries. And it's the overuse injuries that we typically see with these kids that play the year-round sports. They never have a chance to really heal.
Okay, let's talk about, suppose like your son or daughter, maybe they get a sprain or a pulled muscle. What can we do as parents to help that?
Well, the most important thing is to identify problems early, because sometimes a health professional needs to be involved, but we really kind of stick to the main thing, and that is the RICE technique, which is rest, ice, compression, elevation. And if those things don't work early on, then they really need to get evaluated.
Okay, so how many days are we talking to let it go before we go see somebody?
Well, if they're unable to bear weight on the extremity, I wouldn't wait. If they can bear weight or get along okay, but you know, 2 or 3 days, if they're still complaining about things, you shouldn't wait. And the main thing is, if we can diagnose problems early, then we have a chance to solve them. Whereas if we see them too late, then you end up with a real problem.
Real quick on that subject, though, when somebody has a sprain, I mean, you always hear they need to walk on it, walk on it, walk on it. Is that true?
Well, that kind of goes back to that old adage of, you know, no pain, no gain. And truth be told, we need to be very careful with young athletes. Again, they have growth plates, they're still growing. If they've injured one of those areas, then it can be very detrimental in the future. So walking it off isn't the best thing to do.
Isn't always the best idea. What about, let's talk about concussions.
Well, concussions has become a big topic in athletes around the world because we're starting to learn what it actually does to the brain. It's a brain injury. The brain is struck and it moves around inside the skull, and that causes injury. It can range from very mild to very severe, and determining what is mild and what is severe really determines the treatment, whether they can go back to play, whether they should go back to play, and how soon.
Does it ever heal?
It depends. It depends on probably the genetics of the individual, and it also depends on the severity of the injury and how often it's happening. You hear all the time about these kids that are re-injured and re-injured and re-injured, and that's sort of like the boxing guy that gets a concussion every time he boxes.
Real quick, just tell us the symptoms that we should look for if we think our child has a concussion.
Well, you know, if they lose consciousness during the event, then it most likely is going to be a concussion. But slurred speech, forgetting things, not really knowing where they are, different sizes in their pupils, those kind of things can all lead you to think that they might have a concussion. But really, it needs to be evaluated by somebody who's trained to do that.
And then followed up again by somebody that's trained to do that. If you want any more information on this topic, because it's out there, and we all have kids right now, possibly our grandkids that are involved in something, just go to our website, abc4.com, click on Good Things Utah. We will link you right there. Ogden Clinic. You can give them a call. That was their number and all their information. If you want to go see Dr. Stucki, you can certainly make an appointment. And, you know, it's always good for parents to get educated. And so I would imagine you're thinking, please bring me the questions or things that have happened with your child so you can help out.
Yeah,
with that.
absolutely. Ask the questions, and there's lots of help online. The American Academy of Orthopedic Surgery has linked up with a site called Avoid Sports Injuries or StopSportsInjuries.org, and that's a good place to go for sport-specific preventions.
All kinds of good advice. Glenn, I know your wheels are thinking over there, aren't they?
I am thinking you've got to protect those little ones for sure. Hey, coming up